So 10 months on oral minoxidil. Was it worth it? Probably. Let me explain you why. So first of all, I was Norwood 5A and I lost majority of my hair. I had quite a few hairs in my top of the crown and a little bit hairs in the mid-scalp, the native hairs that I'm talking about, before undergoing any of the hair transplants. I've obviously had 2 right now. There's not much hair left to boost, with minoxidil to, lengthen the anagen phase, which is a growth phase, so the hair can basically grow longer and thicker. But having 2 transplants, I still decided to hop on the oral minoxidil bandwagon, so-called, mainly because I wanted to give myself the best chance possible to keep basically all the native hair that I've got, because every little helps to create a, illusion of density. And since my donor area has limited supply, just like yours, I guess, if not, it's good for you.
Look at this dude.
I need to be very careful, how much hairs and grafts I'm using for the transplant. If you've been watching my previous updates, especially on my transplants, you know that with the transplant I covered my frontal third and mainly mid-scalp. Very, very slightly touching the crown, but not going inside the whorl. The rest is all native hair, and the whorl was the main area basically I was looking into, when assessing the kind of, efficacy of the oral minoxidil. If you compare my crown the way I was looking before my second transplant, when my hair was like, pretty kind of similar length and everything, and right now, 10 months after being on 2.5 milligram of oral minoxidil, it's nothing mind-blowing that you've seen, for some of these people online, especially on Reddit, that, been taking oral minoxidil and they just like growing hair everywhere. But nonetheless, in my experience, I think it was worth it. Mainly because I've noticed in general, all hair, all over my scalp got a tiny bit thicker. And since I've got really, really fine, caliber of hair was 51 microns, I feel like even a slight boost in, increased shaft diameter would greatly, boost overall, density of my, transplant and overall, head of hair, basically. Which I actually think did work. Such a shame I don't have this, tool to measure the hair thickness. That would be really useful. Maybe I need to try to organize something. If you've got any ideas, let me know in the comments down below. Which oral minoxidil brand I'm taking? I'm taking Loniten brand, this one actually. This is the 10 milligram Loniten brand. Believe it or not, that comes from Australia. A friend of mine that is actually Australian, he came to England, and 10 milligram I'm taking 2.5 milligram. I'm splitting them in 4 with this little tiny pill cutter. It's really handy, actually, has a little tiny blade in there. And there you go, there's some, can you see them? There's some pills in there. Split. This is how this pills look like, the quarter of a pill. So this allowed me to have a super cheap supply of oral minoxidil, and specifically Loniten brand. And I'm not a big fan of buying, from like shady websites like all the chemists, for example, because you really don't know what you're getting and where is it coming from. Surely a lot of people gonna swear by it, but you know what, like for me, I'd rather get a bit more expensive from a pharmacy or, So this tube gave me about, I think, 14 months of supply if I'm taking the 2.5 milligram. And so people ask me what is my maximum dose I will willing to try in the future or even right now. And my answer is 5 milligram. I'm not planning to get any more than 5 milligram simply because there is not much research on it. All the research is mainly done on 5 milligram. On oral minoxidil, however little research we have. And also it gets into the area where it's a bit more dangerous, between 10 and 40 milligrams of oral minoxidil been prescribed for hypertension, and actually nowadays there are even better drugs than this for this reason. So not really many places actually using this. It's like a last resort hypertension drug, because there's a lot of pretty like bad nasty side effects, especially cardiac side effects. So hence why I'm not planning, and I don't want even to explore anything higher than that. And I actually prefer to stay on 2.5 milligram. So that's what I've been doing for the last 10 months. And I feel, to be honest, great. I don't feel any side effects at all. No swelling, no heart palpitations, maybe just a tiny bit of hypertrichosis in between the eyebrow and the temple peak. Just there is like a tiny bit more hair than there were before. And actually, it's not like a new hair sprout. The hair was there, but they were like a super thin, like almost like translucent, you really didn't see them. And while with the Minoxidil, basically they got tiny bit like darker and grew a little bit thicker because of the, you know, prolonged anagen phase. But again, nothing really that bothers me. I to be honest, even forgetting to plug this hair is just, it's such a small amount, it's really negligible. I know some people getting really severe hypertrichosis, so too bad for them. Luckily for me, I don't have anything really bad. If you've been watching my 10-month hair transplant update that I uploaded, I think last week, I was talking a lot about shedding, that I'm currently experiencing a lot of shedding. So much hair is just in the shower, in the hands, you know, even like right now, even I've got, now it's a bit less because I just washed my hair and it looks actually really nice and clean. And to be honest, most of this hair that shed, I'm contributing to basically oral minoxidil, because I still had quite a few thin miniaturized hair in my mid-scalp and crown that, you know, benefit from the oral minoxidil to get some boost. And so basically their anagen growth phase extended, they were growing for a longer time, but there's obviously an end to it. So, you know, they changed the cycle to catagen phase, then they went to telogen phase, and hence, you know, the shedding. And most of my shedded hair, they look really like a much thinner. They don't look like a thick transplanted hairs, although some of them were, hence why I mentioned, you know, in my transplant video. And for example, today I just washed my hair with a shampoo, and in the bathtub it's quite a lot, you know, of hairs. Mind you, this is already after, you know, I washed all the shampoo and everything, so most of this shed hair already went down the drain, and this is what, like, leftovers basically, and still quite a lot. And even when I'm combing my hair, you know, towel drying, just look in the sink, a lot of hairs. Again, some of them, they look thicker than the others, so these thicker ones, they're most likely going to be transplanted. And this shedding was happening for the last, I would say, almost 3 months. And I'm expecting the shedding to really stop anytime soon. Of course, I'll update you guys on this. I will still keep taking 2.5 milligram of oral minoxidil. I'm not going to change anything. And I'll see in the next couple of months how it's going to look. Also looking at the hairs in this area, this picture was taken literally right now. There are quite a few thin miniatures hairs in the mid-scalp. This picture literally taken in the mid-scalp, and you can clearly see the difference between the transplanted hairs. For example, this one over here, this one. It's like they look just much thicker. And the native miniatures hair over here, quite a lot of them actually. If you look, all of this, you know, thinner, finer hairs, you know, here for example, these are my native hairs that you know, got quite thicker, to be honest, due to oral minoxidil. And you know, because there's quite a lot of them, they're contributing to the, you know, overall, you know, visual density basically, quite substantially. Just look at that, like, you know, they're able to grow pretty long as well. So yeah, and every little helps. This is basically yeah, why I'm keep using the oral minoxidil. So far I'm really happy, to be honest, and I feel like definitely oral minoxidil give a great amount of, you know, boost to miniaturized hair, and even overall, even the transplanted hairs, they got a little bit like a thicker. A lot of people actually noticed that my hair look a little bit thicker everywhere, so that's a great plus. If you've got any questions, make sure to drop them in the comments down below. I'll happy to answer all of them as usual. And if you haven't already, subscribe to the channel, it helps a lot. And also like this video, that helps tremendously for the YouTube algorithm. And thanks so much for watching, and I'll see you next one. Peace out.